Thank you, Honourable Chairperson, and thank you also to the previous speakers and to the input already given. I would like to build on that from AfriForum side. My name is Boshoff, and I am speaking on behalf of AfriForum's more than 300,000 members. So during this submission, I want to focus on the actual problems with or facing the South African healthcare system, hampering healthcare provision in South Africa, and I would like to provide some alternative solutions which will be better than the current proposed NHI system. So the first problem facing South African healthcare is that there are not enough healthcare providers in the country. The latest statistics indicate about 1 doctor to every 3,200 South Africans. This means if we were to take this hall to represent South Africa, there would be more or less 1/10 of a doctor in South Africa, or in this hall. I don't know if you saw the guy, he must be like really small if there's 1/10 of a doctor here. But in any case, if there are so little doctors or so little healthcare providers in South Africa, then it doesn't matter how you distribute them or where they provide their services, in public sector, in private sector, through NHI, without NHI, there are not enough doctors, there are not enough nurses, and these are the problems that need to be addressed. There needs to be more healthcare providers trained to provide healthcare services in South Africa. And so what goes along with that, as polls have indicated, that many healthcare providers, such as doctors, are considering leaving the country if NHI were to be implemented. Now, this has been discussed to some extent, and some proponents of NHI have said, no, they are wrong to consider leaving South Africa. It will not be necessary for them to leave South Africa. And that may be the case, but polls indicate that doctors are intending to leave the country, and that will happen whether they are correct to leave the country or not. And that will leave us with less healthcare provision in South Africa. So I want to urge everyone to seriously think about this and think whether there will be enough healthcare provision, even if the NHI system was 100% correct. If it moves doctors to leave the country, moves nurses or pharmacists or healthcare providers to leave the country, then in the end there will be less healthcare provision in South Africa. Secondly, and tied to that, is a problem with the financing of healthcare in South Africa, which is insufficient. So healthcare costs money, whether it is financed through medical aids, through out-of-pocket payments, or through tax money. Healthcare costs money. In the end, there needs to be a healthcare provider taking time out of his day, delivering the service, and who needs to be reimbursed for that. So the problem in South Africa is a lack of disposable income for South Africans to pay for healthcare services. And to change the system and say that healthcare will be provided for by government reimbursements will not make healthcare free. It will just make it paid for in another manner by the government. And as has been noted, that the government's record on such payments is not good at the moment. There will be a huge door open for corruption and huge doors open for inefficiencies in healthcare financing. So, and also to move on to that, for NHI to be implemented, it will require tax increases. And there have been many suggestions as to exactly which taxes and whatever, but the point stands that there will need to be tax increases, and tax increases affects everyone in the country. It in fact affects the entire economy, not just the rich people. For example, the government sometimes adds to the fuel levy, which then adds to travel costs, which adds to taxi fares, and in the end it affects everyone in the country. Or they add to VAT, which affects the price of almost all products in South Africa. So the problem with NHI is that if a new fund is to be started, it needs to be funded through tax money, which will in the end affect everyone in the country. So also to add a comment on the presentations in the beginning of this session, where there has been stated or much have been mentioned about the distribution of healthcare between public and private sector, and the percentages of what is in the private sector and what is in the public sector. But we also need to look at the absolute figures and not just the relative figures, not just the percentages. You can keep on splitting the healthcare in the country more equally, but the total healthcare keeps declining, and then in the end you just don't have enough healthcare to split equally anymore. So from AfriForum's side, our view is that the economic climate should be created to increase healthcare provision, not just to redistribute the current healthcare in the country. For this to happen, there needs to be proper healthcare training in the country. Nurses and doctors and pharmacists need to be trained, and these healthcare careers need to be profitable. So people need to be able to say, I want to become a nurse, I want to study to become a nurse or a doctor, so that I will have an income to support my family, and I need a stable healthcare system for that to happen in, and that system is not NHI. Therefore, I want to conclude that from AfriForum's side, as has been mentioned by many submissions or in many submissions today, that there may be different approaches to either amend the bill to make major amendments, which we can consider, but as it stands currently, the NHI bill should rather be rejected by the National Council of Provinces. Thank you.